Increasing numbers of sporty children and adolescents are presenting to healthcare professionals with sport-related overuse injuries, growth plate pathology, bone stress injuries, and training load-related pain. But what we're also seeing is children as young as 11 and 12 with suspected relative energy deficiency in sport. The problem is that pediatric anatomy brings unique pediatric pathologies, and children do not finish skeletal maturation until they're aged over 23 years of age, and in some even later. Two children of the same age may be as much as 3 years more or less mature than each other, so knowing their date of birth does not necessarily inform clinical decision making. These facts are rarely considered amongst adult MSK clinicians, especially because most healthcare practitioners were never formally trained in these differences between adults and children. Unknowingly, clinicians are treating younger patients with growth-related presentations every day in NHS and private clinic settings. You don't know what you don't know, so if you're not aware of these key differences in the adolescent anatomy, pathology, and injury management, why would you seek out alternative explanations or diagnoses? This can lead to poorly informed clinical reasoning, misdiagnosis, and long-term complications for the young athlete. It can lead to potential litigation, but critically harm your local reputation. How often are we asked by a parent we've previously successfully treated to see their son or daughter? They mistakenly think that because we did a good job for them, we can do the same for their child. But that is not always the case, and we need to ask ourselves whether we have the skill set to safely treat their child. Kids Back to Sport is an education-led initiative dedicated to empowering and educating parents, coaches, and health professionals, improving access to high-quality rehabilitation for youth athletes, reducing the long-term complications from missing growth-related injuries. Kids Back to Sport provide free educational resources such as online courses to videos to ebooks about how to get injured young athletes safely and confidently back to sport. Download the QR code sheet at Kids Back to Sport so you can easily share these evidence-based resources with patients, creating consistently high quality patient educational backup to your treatments. There are multiple benefits to being involved with Kids Back to Sport. The key benefit is to develop the confidence and skills to get great outcomes working with sporty kids. We can support you to build a new revenue stream working with schools and clubs and attract new patients with a listing on the Kids Back to Sport directory. By keeping up to date with ongoing CPD, you will improve staff development and therefore retention, and helping you build a great team and a great reputation locally that people trust. On the Kids Back to Sport website, alongside the free resources, is a directory of health professionals who understand the unique needs of young injured athletes, helping parents to find the right person to help get their child safely back to sport. We urgently need more clinicians to join the directory, so do sign up to take the free assessment quiz now. It's suitable for health professionals who hold a degree level qualification in physiotherapy, sports therapy, sports rehabilitation, osteopathy, and chiropractors. If you do hold other qualifications that you think are relevant, then just contact me directly and we can discuss that experience. The important part is that everyone has to pass the same quiz to protect standards for parents and clinicians alike. The assessment quiz is free to take, and once you successfully complete the process, you can become a listed Kids Back to Sport practitioner. Just scan the QR code or visit Kids Back to Sport. And for larger clinics, there's an opportunity to become a centre of excellence with multiple benefits that goes with it. If after taking the quiz you identify that you might need to learn more to safely treat young athletes, you can complete the Kids Back to Sport course online or in person. The courses will help you gain the confidence to learn about adolescent MSK anatomy and pathologies, how to assess maturation status and recognise bone stress injuries, overtraining and relative energy deficiency in sports. You'll learn how to assess baseline movement capacity, set exercise programs that kids will actually do, and how to educate the parent and the child to ensure a confident return to play and prevent a recurrence. The course is applicable to therapists with a degree-level undergraduate knowledge who see sporty kids in their clinical setting, both within private, sports clubs and NHS settings. This is not just a course for therapists who work with elite athletes, but those children who are injured from juggling multiple sports as they go through the adolescent growth spurt. Angie's delivered training across a broad spectrum of elite academy settings, NHS departments, and for multiple professional bodies and clinical education platforms. She's an experienced youth athlete consultant physiotherapist dedicated to transforming the care of young athletes. She was that young sporty child, and through a lack of awareness and the right information, her sporting career was cut short by injury. She's the mum to two highly successful international athletes and has helped many more achieve sporting success. She's a passionate educator and is on a mission to raise awareness of how sporty kids are not mini adults and how they have their own unique anatomy, pathology, and treatment needs. She regularly lectures worldwide, delivering workshops at conferences. For nearly 2 decades, she's consulted for the Cheshire Cricket Board, developing Ready for Cricket, a unique online injury prevention programme, and authored a chapter on the prevention of lumbar bone stress fractures in the recently released book on cricket sports medicine.